In this video, we're going to be exploring the top 3 vitamins for diabetics that are proven to help support healthy blood sugar levels. Let's get into it. Hey everybody! Hey everybody! If you're looking to take control of your health and learn how to prevent and manage diseases through your diet, make sure you subscribe to my channel. Every week I'm uploading new videos that will teach you all about the power of nutrition. With that being said, let's get right into today's topic, which is all about the 3 best vitamins for diabetics. Diabetes is a condition that affects millions of people worldwide, and it can cause some serious complications if it's not properly managed. But did you know that certain vitamins can actually help improve your blood sugar levels? In this video, we'll be taking a look at 3 vitamins that have been proven to help keep your blood sugar in check and reduce your risk of developing diabetes-related complications. So make sure you stick around until the end to find out what they are. Vitamin D, also known as the sunshine vitamin, is produced in the skin when exposed to ultraviolet radiation from the sun. It plays a crucial role in maintaining healthy bones and teeth, but recent studies have also shown that it has a significant impact on blood sugar regulation. Studies have shown that people with type 2 diabetes often have lower levels of vitamin D in their blood than non-diabetic individuals. This suggests that there may be a link between low vitamin D levels and an increased risk of developing type 2 diabetes. One study published in the Journal of Clinical Endocrinology and Metabolism found that people who took vitamin D supplements had lower fasting blood sugar levels and improved insulin sensitivity compared to those who received a placebo. Another study published in Diabetes Care showed that increasing vitamin D levels through sun exposure or supplementation reduced the risk of developing type 2 diabetes by 22%. These findings suggest that maintaining adequate vitamin D levels may be an effective way to prevent and manage type 2 diabetes. There are a few ways to maintain adequate vitamin D levels. The easiest way is to take a supplement, especially if you live in an area with limited sunshine or have difficulty being outdoors. The recommended daily intake of vitamin D is 600 to 800 international units, but diabetics may need higher amounts to see a significant improvement in blood sugar levels. In addition to taking a supplement, you can also get vitamin D from certain foods such as fatty fish, such as salmon and tuna, as well as fortified foods like milk and cereal. However, it's important to note that getting enough vitamin D from food alone may be difficult, and a supplement may be necessary. Now, before we move on to the next vitamin, I want to share a story of one of my patients. She was diagnosed with type 2 diabetes several years ago and was struggling to manage her blood sugar levels. After implementing dietary changes and taking supplements, including vitamin D, her A1C levels dropped significantly, and she was able to reverse her diabetes. She now lives a healthy and active lifestyle and no longer needs insulin or diabetes medication. Her story is a great example of how lifestyle changes and supplements can help improve blood sugar levels and potentially reverse type 2 diabetes. It's important to consult with a healthcare professional before starting any new supplements, especially if you are taking medication for diabetes or other medical conditions. They can help you determine the right dosage and monitor for any potential side effects. Number 2. Chromium. Chromium is a trace mineral that plays an essential role in maintaining normal blood sugar levels. It does this by enhancing the activity of insulin, which is a hormone that regulates blood sugar. Chromium also helps improve insulin sensitivity, which means that your body can use insulin more effectively to lower blood sugar levels. Studies have shown that people with type 2 diabetes often have lower levels of chromium in their bodies, suggesting that chromium deficiency may play a role in the development of diabetes. One study published in the journal Diabetes Care found that supplementing with chromium picolinate, a highly absorbable form of chromium, led to a significant reduction in fasting blood sugar levels in people with type 2 diabetes. Another study published in the journal Nutrients showed that chromium supplementation improved glycemic control and reduced the need for diabetes medication in people with type 2 diabetes. These findings suggest that chromium may be an effective supplement for managing blood sugar levels and improving diabetes control. The recommended daily intake of chromium varies depending on age and gender, but most adults should aim for around 25 to 35 micrograms per day. However, diabetics may need higher amounts of chromium to see a significant improvement in their blood sugar levels. Chromium can be found in a variety of foods, including broccoli, turkey, whole wheat, and eggs. However, it's important to note that the amount of chromium in food can vary widely, and it may be difficult to get enough chromium from food alone. In these cases, a supplement may be necessary. There are many different forms of chromium supplements available, but it's important to choose a product that contains a highly absorbable form of chromium, such as chromium picolinate. Before starting any new supplements, it's always important to talk to your doctor, especially if you are taking medication for diabetes or other medical conditions. Chromium supplements can cause side effects such as headache, nausea, and diarrhea. So it's important to start with a low dose and gradually increase it over time. At number 3, we have alpha-lipoic acid. Alpha-lipoic acid is a powerful antioxidant that plays an important role in the production of mitochondrial energy in the body. It has been shown to have a variety of health benefits, including reducing inflammation, protecting against nerve damage, and improving brain function. One of the most promising uses for alpha-lipoic acid is in the management of diabetes. Studies have shown that alpha-lipoic acid can help regulate blood sugar levels and improve insulin sensitivity, leading to better glycemic control in people with diabetes. A study published in the journal Diabetes Care found that alpha-lipoic acid supplementation led to a significant reduction in both fasting blood sugar levels and A1C levels in people with type 2 diabetes. Additionally, alpha-lipoic acid has been shown to reduce the risk of diabetic complications such as nerve damage and kidney disease. A study published in the Journal of the American Medical Association found that alpha-lipoic acid was effective in improving nerve function in people with diabetic neuropathy. Another study published in the Journal of the American Society of Nephrology showed that alpha-lipoic acid supplementation reduced the risk of kidney disease progression in people with type 2 diabetes. While alpha-lipoic acid is generally safe and well tolerated, it's important to note that it can cause some mild side effects, such as nausea, diarrhea, and abdominal pain. However, these side effects are rare and typically disappear after a few weeks of treatments. It's also important to note that alpha-lipoic acid can interact with certain medications, including blood thinners and diabetes medications. So it's always best to consult with a doctor before starting any new supplements. Alpha-lipoic acid is available as a supplement in both oral and injectable forms. The dosage typically ranges from 600 to 1200 milligrams per day, depending on the severity of your symptoms and the underlying cause of your health concern. It's important to follow the instructions on the packaging or as directed by your doctor. While more research is needed to fully understand the benefits and risks of alpha-lipoic acid, the available evidence suggests that it may be a valuable tool for managing diabetes and its related complications. As always, it's important to speak with your doctor before adding any new supplements to your routine. Overall, these 3 vitamins, vitamins D and C and alpha-lipoic acid, offer a natural approach to supporting healthy blood sugar levels and reducing the risk of diabetes-related complications. By incorporating them into your daily routine, you can take proactive steps towards managing your diabetes and improving your overall health. Remember to consult with your healthcare provider before making any significant changes to your diet or supplement routine. And always prioritize a balanced, nutritious diet and regular physical activity as the foundation of your diabetes management plan. Thank you so much for watching today's video. If you enjoyed the content, please give it a like and subscribe to my channel for more informative videos on diabetes and nutrition. Stay healthy and take care.